Okay, what we will be discussing today is how the decreased lung or chest wall compliance will affect the different waveforms. In a patient who's on volume controlled mode of ventilation with a targeted tidal volume of 500 that is delivered at flow rate of 30 liters per minute, inspiratory time is 1.5 seconds and the rate is 12 per minute. You can see how the pressure goes up initially to overcome the airway resistance and then gradually to the peak inspiratory pressure overcoming the lung elastance. Once we have inspiratory hold with the plateau pressure required to overcome the lung elastance only, the difference between the peak inspiratory pressure and the plateau pressure is again the pressure required to overcome the airway resistance. Now, if the lung elastance is decreased, what we will notice on the waveforms is the following. The initial rise in the pressure from this point to this point is exactly similar to the previous breath. Here where the chest wall or the lung compliance decreased. The slope of the increase of the pressure from this point to the peak inspiratory pressure point is increased, indicating that the lung or chest wall compliance is decreased. The difference between the peak inspiratory pressure and the plateau pressure is similar to the previous one, indicating that there is no increase in the airway resistance. The plateau pressure is increased, which is the pressure required to overcome the lung elastance or the chest wall elastance, and this indicates that there is a problem with the either the lung or the chest wall. Now, if you take a look on the expiratory phase, what you will see is the peak expiratory flow is increased compared to the previous breath, and it requires less time to exhale, indicating that the time constant for this patient, which is the time required to exhale 2/3 of the air in a single breath, and it's calculated by the formula of resistance multiplied by the compliance. If the time constant is decreased, that indicates either the resistance is decreased or the compliance is decreased. In this case, the compliance is decreased. So again, the peak expiratory flow is increased and the time required to exhale completely to the baseline is decreased compared to the previous breath. In summary, increased lung or chest wall elastance is indicated by increased peak airway pressure, increased plateau pressure. The difference between peak airway pressure and plateau pressure is the same, no changes, and in expiration, the peak expiratory flow is increased and the time to exhale is decreased. This can be caused by a pneumothorax, hemothorax, congestive heart failure, pulmonary edema, pneumonia, worsening ARDS, or atelectasis. Thank you.